So when measuring knee hyperextension, it's important that you have complete clearance under both the thigh as well as the calf. And then you can see that the knee gradually sags into a little bit of hyperextension there. The measurement would be taken as such. Okay. Aligning with the greater trochanter as well as the lateral malleolus of the left knee. Perfect. When you're looking at the joint play, so having one hand just proximal to the joint line and then the other hand just proximal to the malleoli, I'm going to have a counter pressure, almost like a seesawing effect. So if I was to show on the other side, it would be like this. And then I would gently get a lift there to get the sense of end feel. A more advanced and robust technique is giving a little bit of rotation so that you would add a slight varus and or valgus force with the overpressure to get a better sense of the other compartments of the joint and the joint capsule. But this is really what you want to try and get to, is that from side to side, you're having symmetry of the hyperextension. Okay, when we're looking at patella mobility, again, it's going to be 2 quadrants lateral, 2 quadrants medial. Tibial rotation can be measured by flexing the knee up to 90 degrees, locking out the ankle into dorsiflexion. I have one finger on the tibial tuberosity, one finger on the patella, and then I'm actually rotating, and we're expecting for about 20 degrees from side to side. It's a subtle motion, difficult to objectify. You're going to need to have a good feel and practice for this over time across multiple patients, and then also comparing it within the patient to their opposing limb. Okay, so when we're looking at tissue compliance for knee flexion, and particularly once you've gone from that jogging and that initial agility phase and needing to get into the plyometrics and the sprinting, is that you would flex the joint up, and then you would find the first resistance, which is like right there, and then the second resistance is if I continue to push, can I get the heel to the bum? And then you'd be comparing that from the involved versus the uninvolved limb. So if we come to the opposing side, same thing, bring it to its natural first stop. There's the first tissue resistance. And how much resistance does it take me to get from my R1 or my resistance 1 to my resistance 2? And you want good tissue compliance from side to side, particularly when you're going through that back kick with your sprinting and your higher level athlete.